Introduction to Psychiatric Hospitals. Psychiatric hospitals, also known as mental health hospitals or psychiatric wards, are specialized medical facilities dedicated to the treatment and care of individuals with severe mental health disorders. These institutions play a crucial role in the mental health care system, providing both short-term and long-term treatment for patients who require intensive psychiatric care that cannot be managed through outpatient services. Historical evolution of psychiatric hospitals. Ancient and medieval periods. The treatment of mental illness dates back to ancient civilizations. Early theories often attributed mental disorders to supernatural forces or divine punishment, leading to a variety of inhumane treatments. Ancient Egyptian, Greek, and Roman societies had rudimentary understandings of mental health, but systematic treatment facilities did not exist. During the medieval period, those with mental illnesses were often confined to monasteries or almshouses. The approach was largely custodial rather than therapeutic. Mentally ill individuals were frequently subjected to harsh conditions, with little understanding of their conditions. The asylum era. The 18th and 19th centuries saw the establishment of asylums, which were the precursors to modern psychiatric hospitals. These institutions were intended to provide refuge and care for the mentally ill, but often fell short of their idealistic goals. The term asylum became synonymous with overcrowding, poor living conditions, and inadequate treatment. Notable reformers like Philippe Pinel in France and Dorothea Dix in the United States advocated for more humane treatment of the mentally ill, leading to the development of moral treatment. This approach emphasized kindness, routine, and engagement in productive activities. The rise of psychiatric hospitals. In the late 19th and early 20th centuries, the construction of large psychiatric hospitals became common in Europe and North America. These hospitals aimed to provide comprehensive care, including medical treatment, occupational therapy, and recreation. However, the rapid expansion often led to overcrowding and underfunding, causing a decline in care quality. The discovery of psychotropic medications in the mid-20th century revolutionized psychiatric treatment, offering more effective management of symptoms and enabling many patients to leave institutional care. This period also saw the deinstitutionalization movement, which sought to integrate individuals with mental illnesses into the community, supported by outpatient services. Types of psychiatric hospitals. Public psychiatric hospitals. Public psychiatric hospitals are funded and operated by government entities. They provide services to a wide range of patients, often focusing on those who are uninsured, underinsured, or have severe and persistent mental illnesses. These hospitals play a critical role in the mental health care safety net. Private psychiatric hospitals. Private psychiatric hospitals are funded through private payers, including insurance companies and out-of-pocket payments by patients and their families. These hospitals often offer specialized services, shorter wait times, and more amenities compared to public institutions. They may cater to specific populations, such as adolescents, veterans, or individuals with substance use disorders. General hospitals with psychiatric units. Many general hospitals include psychiatric units or wards, providing acute psychiatric care within a broader medical facility. These units are crucial for addressing psychiatric emergencies, such as severe depression, psychosis, or suicidal behavior, and often serve as a bridge to longer-term care. Forensic psychiatric hospitals. Forensic psychiatric hospitals specialize in the treatment of individuals involved with the criminal justice system who have mental health disorders. These facilities provide assessment, treatment, and rehabilitation services for patients deemed unfit to stand trial, not guilty by reason of insanity, or requiring mental health treatment as part of their incarceration. Treatment approaches in psychiatric hospitals. Pharmacotherapy. Pharmacotherapy involves the use of medications to manage psychiatric symptoms. Common classes of psychiatric medications include antidepressants, used to treat depression, anxiety, and other mood disorders. Antipsychotics, used to manage psychosis, including schizophrenia and bipolar disorder. Mood stabilizers, used to treat bipolar disorder and mood swings. Anxiolytics, used to alleviate anxiety. Stimulants, used to treat attention deficit/hyperactivity disorder, ADHD. The selection and management of medications require careful consideration of the patient's symptoms, medical history, and potential side effects. Psychotherapy. Psychotherapy, or talk therapy, is a cornerstone of psychiatric treatment. Various therapeutic modalities are employed, including cognitive behavioral therapy. CBT focuses on identifying and changing negative thought patterns and behaviors. Dialectical behavior therapy, DBT, combines CBT with mindfulness techniques, often used for borderline personality disorder. Psychodynamic therapy explores unconscious processes and past experiences to understand current behavior. Interpersonal therapy, IPT, addresses interpersonal issues and their impact on mental health. Family therapy involves family members in the treatment process to improve communication and support. Electroconvulsive therapy, ECT. ECT is a medical treatment that involves the administration of electrical currents to the brain under general anesthesia, inducing a brief seizure. It is primarily used for severe depression, treatment-resistant depression, and certain other conditions when other treatments have failed. Despite its controversial history, ECT is considered safe and effective when performed under modern guidelines. Other somatic treatments. Transcranial magnetic stimulation, TMS, a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain, often used for depression. Vagus nerve stimulation, VNS, involves the implantation of a device that stimulates the vagus nerve, used for treatment-resistant depression and epilepsy. Occupational and recreational therapy. Occupational therapy helps patients develop skills for daily living and work. Recreational therapy involves activities such as art, music, and exercise, which can improve mood, socialization, and overall well-being. Integrated care models. Many psychiatric hospitals are adopting integrated care models, which combine mental health services with primary care and other medical services. This approach addresses the holistic needs of patients and improves coordination of care. Challenges facing psychiatric hospitals. Stigma and discrimination. Despite progress in understanding mental health, stigma and discrimination against individuals with mental illnesses persist. This can affect funding, public perception, and the willingness of individuals to seek treatment. Combating stigma requires ongoing public education and advocacy efforts. Funding and resource constraints. Many psychiatric hospitals face significant funding challenges, impacting their ability to provide comprehensive care. Underfunding can lead to staffing shortages, inadequate facilities, and limited access to cutting-edge treatments. Workforce shortages. There is a critical shortage of mental health professionals, including psychiatrists, psychologists, nurses, and social workers. This shortage can lead to increased workloads, burnout, and difficulties in providing timely and effective care. Integration with community services. Deinstitutionalization has shifted the burden of care from psychiatric hospitals to community-based services. However, the availability and quality of these services vary widely. Effective integration and coordination between hospital and community services are essential for seamless patient care. Ethical and legal issues. Psychiatric hospitals often navigate complex ethical and legal issues, including involuntary commitment, patient rights, and the use of restraints or seclusion. Balancing patient autonomy with the need for treatment and safety requires careful consideration and adherence to legal standards. Future directions for psychiatric hospitals. Emphasis on preventive care. Future psychiatric care will likely place greater emphasis on prevention and early intervention. Identifying and addressing mental health issues early can reduce the need for hospitalization and improve long-term outcomes. Telepsychiatry and digital health. The use of telepsychiatry and digital health tools has expanded significantly, particularly during the COVID-19 pandemic. These technologies increase access to care, especially for individuals in remote or underserved areas, and can enhance continuity of care. Personalized medicine. Advancements in genetics and neuroscience are paving the way for personalized medicine in psychiatry. Tailoring treatments to an individual's genetic profile and specific needs can improve efficacy and reduce side effects. Trauma-informed care. Trauma-informed care recognizes the impact of trauma on mental health and incorporates this understanding into all aspects of treatment. This approach promotes a safe and supportive environment for patients and staff. Community-based and holistic approaches. Future psychiatric care will likely involve a greater focus on community-based and holistic approaches. This includes integrating mental health services with social services, housing, employment support, and addressing social determinants of health. Advocacy and policy changes. Ongoing advocacy and policy changes are crucial for improving the mental health care system. This includes efforts to increase funding, reduce stigma, and ensure that mental health care is accessible and equitable for all. Conclusion. Psychiatric hospitals have evolved significantly over the centuries, from inhumane asylums to modern facilities that offer comprehensive and compassionate care. Despite facing numerous challenges, these institutions remain a vital component of the mental health care system. Future advancements in treatment, technology, and policy hold promise for even more effective and humane psychiatric care. By understanding the history, current practices, and future directions of psychiatric hospitals, we can continue to improve the care and support provided to individuals with mental health disorders, ensuring they receive the dignity, respect, and treatment they deserve. If you enjoyed this video, don't forget to hit that subscribe button and join the NI 655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.